Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Looking at varus deformities, just to get all the terms straight, this implies an angulation toward the midline of the distal segment of a bone or joint, right? Angulation toward the midline. Because the foot is at a right angle to the long axis of the leg, this can be confusing. And varus of the ankle refers to varus plafond or varus tilt. So here's your normal situation where you have your talus, your tibia, and your fibula and neutral. We can have a varus angulation of the plafond that can contribute to this varus deformity. We can also simply rotate the talus, and that can also give you the same degree of varus deformity. Of course, we can have, this is the varus deformity occurring at the subtalar joint, and it has synonyms here. We can call this supination or inversion of the subtalar joint. Varus of the forefoot, again, refers to that elevation of the medial ray like we just saw on the prior slide. And it could be referred to also other synonyms as supination or inversion of the plane of the metatarsal heads. So the varus deformity has a spectrum of anatomic variations from mild to severe, and in many cases, it's not even coming to clinical attention. Varus of the foot and ankle is, though, associated with pes cavus, and that may come to clinical attention more often. But it actually can occur even with a low or a normal arch, as long as the relationships maintain with this implied angulation towards the midline. Looking at foot varus deformity, again, the foot is inverted upon the forefoot in this orientation. So when we're looking at the neutral axis where we have the fibula on the lateral side, and this is the medial first ray, in a situation with forefoot varus, what we notice is that the calcaneus begins to bow outward. As this becomes bowing outward, we see that the forefoot has now come to the ground. So there's been a compensatory where it was valgus and the first ray was up. Now it's on the ground, and it can either pronate the first ray or plantar flex the first ray. So increased ground reactive forces on the lateral aspect of the foot attempt to drive the forefoot on the first ray towards the ground. And with this kind of biomechanic, we can see tibia vera deformities, where we have curvature in the tibia. The rear foot will often follow. And again, this will depend upon the range of motion and of the subtalar joint. Some of the etiologies of what we think may cause this would be in utero fetal positioning, creating a tibia varus, or even an internal tibial rotation. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.